Okay, this is a capture for cardiac, basic cardiac hypertension, CAD, things like that. And so we will get started here. So basically, basic anatomy and flow. Just want you to remember the flow of the heart. When we start talking about heart issues, it's important that you know the anatomy of the heart. How many valves are there? Which ones are there? Where do they, between which chambers do we find the valves, and then the flow of the blood between the vena cava, the atria, the ventricles, the lung, and the aorta. So what's actually impacting which part of the body, whether it's the periphery or it's the lung, if someone has bad valves or if they have hypertension. So review that if you're not familiar and you're not sure which one. So hypertension, we all know about hypertension. It's common. That's why they call it the silent killer, because patients sometimes don't know they even have it. And it's not until they've had a stroke or they have really bad headaches or nosebleeds or they are admitted to the hospital with other complications, and lo and behold, they have hypertension, and it could be hypertensive crisis, 250 over 120, something like that. So it's called the silent killer for a reason. The American Heart Association just revised these recently, but basically, if your systolic is above 140 and your diastolic is above 90, that's an indication that you are pre-hypertensive or may have hypertension if it's been going on for a certain length of time. So 1 in 3 Americans have hypertension. That's a lot. A population of 300 million, 100 million people have hypertension. So hypertension, you have a proportional increase of having an MI, stroke, renal disease, vision problems, if you have hypertension. Before age 55, hypertension is more common in women. After 55, more common in, before 55 men, after 55 women. Why is that? Does it have something to do with endocrine system and menopause, or is it after age 55 women are more stressed and work harder than men? So factors on blood pressure. Don't forget from your anatomy and physiology, especially physiology class and probably patho, your blood pressure equals your cardiac output times your SVR. So there you have it. So if those are increasing, for example, your SVR increases, that's going to increase your blood pressure. So we have ways that we try to compensate that in the body. For example, the sympathetic nervous system is one of them. You have baroreceptors, you have the renal system, and you have the endocrine system. You remember that from pathophys, what each one does and how it basically manages your blood pressure, your cardiac output. We have different systems that take over if we're not meeting the output and the oxygen needs. So primary hypertension, 90 to 95% of all people that have hypertension, that's what they have. There are no known cause that hasn't been proven that one thing causes hypertension, but there's a lot of risks. We know that what can cause, we can increase risk, we can reduce the risk, hypertension will decrease. Secondary hypertension is basically correctable after finding the cause. It's usually brought on by some kind of tumor, a cancer, some other issue. You correct the problem and the hypertension goes away. So most people have primary hypertension. So hypertension, pathophysiology, hereditary. There's a lot of people that have hypertension because it's in the genes. It's passed down. You may hear somebody say, my parent has hypertension, my grandparents had hypertension. That's a component of hypertension that you can't do anything about. Another component is water and sodium retention. Water follows sodium. How much sodium do you retain? How much sodium are you intaking? Another thing is the renin-angiotensin mechanism. Is it altered due to some other disease such as cancer? Stress. Are you in a type 1 stress job? Do you worry a lot? Some people worry about everything, and it makes their blood pressure increase. Um, increased sympathetic nervous system. Stress will do that. Your increased sympathetic nervous system has to do with your flight or fight mechanism. So you're going to produce norepinephrine, which causes vasoconstriction. If you cause vasoconstriction, that increases your blood pressure. Another one is insulin resistance, or poor compliance in managing your insulin. High blood sugars destroy the internal layer of your veins and arteries, especially your arteries. So if it's being torn, getting jagged edges on it, then it's not going to be able to comply over a long period of time. Insulin causes the arteries and arterioles to lose their elasticity. So risk factors. Risk factors for hypertension. Well, look at them there. There's a lot of risk factors. Age, obviously. You can't do anything about your age. Alcohol, you could alter. Cigarette smoking, you can alter. Some people say diabetes, you can't alter. You can modify diabetes by being more in control, managing your BGs at a tighter range. If you're type 1, if you exercise, you probably could get off your diabetic medications. Losing weight would help. Elevated serum levels, that's another one. Excess dietary sodium. Gender, you cannot alter, obviously. Genetically anyway. Family history you can't alter. Obesity you can alter. Ethnicity cannot. Sedentary lifestyle you can. Socioeconomic status, you find people lower economic status have poor eating habits, so that will increase your excess dietary sodium. Stress can be altered as well. So some of the factors are modifiable, some are not.